Welcome back, guys. Now let's discuss about X-linked disorders. Now in this X-linked disorders, we have to discuss about both X-linked dominant and X-linked recessive disorders. The first point which I want you to know is these genes or these disorders are associated with the X chromosome. See, X chromosome, X and Y are the 6 chromosomes. Okay, so the genes whichever I am discussing, they are present on the sex chromosome. The diseases are sex related diseases, or I should say, don't think that there is something abnormal with the sex. No, something not like that. So these genes are present on this X chromosome, which is a sex chromosome. Okay, so first let's discuss about X-linked dominant inheritance pattern. The first important point, sir, in this X-linked, not dominant, first we will discuss about the X-linked recessive pattern. In the X-linked recessive pattern, mainly males are affected. First we will discuss about the X-linked recessive, later we will discuss about the X-linked dominant. In X-linked recessive disorders, I have explained you mainly who are affected, mainly males. Male sex is going to be affected. Why male sex is affected, sir? Now let's see, male and female. Now male is having X chromosome and Y chromosome, female is having XX chromosomes, right? Now for example, female is affected, small x is there and one capital X, small x and capital X. Male is having one Y, X and Y, okay, X and Y. Female is having 2 X chromosomes. Here I am showing you, see, this female is a carrier. See, female is a carrier, though she is having a mutated gene on X chromosome, that's why I am showing it as a small x. Now she is having a mutated gene, but still she doesn't have any problem because she is having a dominant allele. See, on this X, normal allele is there and it's functioning, okay, no problem. Okay, female will be a carrier. Now see, whenever they have a children, okay, whenever this couple, whenever they have a children, what happens? Look, this one X and this small x. So X and small x, XX means female, this is a female child. Now one X and one X, so one capital X, other also capital X, this is also female, no issue. Next, X and Y, so small x and Y, so this is a male, and like this, one normal X, normal Y, this is also male. So whenever this couple, whenever they have children, it's very much obvious 50% of the carrier, 50% of the progeny, offspring is going to be male. Look, 50% males, 50% females. But see, who is affected? Which sex is affected? Males or females? See, male is affected. Okay, male is affected. Here, this fellow is affected. Okay, this is a normal male. This is normal male. This is normal female. And this is a carrier. This is a carrier female. Because one small x is there, but one capital X is there. This is a dominant allele. So she is a carrier female. No issue, no problem. Okay. So always I want you to know one point. Usually in X-linked, usually in X-linked recessive disorders, who is affected? Males are affected. Okay. Now let's see some exceptions. Okay, exception conditions. What are the exception conditions, sir? Which means female affected with X-linked recessive disorder. So in which conditions will female get the X-linked recessive disorders? In which conditions you will get the X-linked recessive disorders? See, there are 3 exceptions which I want you to know. The first exception is Turner female. Turner female. So Turner female, what exactly is the problem? It's a chromosomal disorder, right? That's a 45X0. Now she is having only one X chromosome, just like male. Males have one X chromosome. Now she is also having one X chromosome. One X chromosome is lost. What if this X chromosome is small x? Now she is like this 45 small x0. Now she got X chromosome from the father and it is small x. Okay. Now this female, this Turner female, yes, she can develop X-linked recessive disorders. Simple. Okay, she can develop X-linked recessive disorders because she is only having one X. So possible. Second possibility is a phenomena called as lionization. So what exactly is this lionization, sir? Usually, how many chromosomes do I have? Males have X and Y. Okay, X and Y, only one X is there. How many X chromosomes are there in female chromosome? 2 X chromosomes are there. So there is an imbalance. Males is having 1 X chromosomes, females are having 2 X chromosomes. So females, what happens is, out of their 2 X, okay, out of their 2 X, 1 X is going to be silenced. Okay, 1 X is going to be absolutely silenced randomly. Okay, randomly there are 100 cells. In 100 cells, this X, if for example in 50 cells this X is silenced, in 50 cells this X is silenced. Okay, the silencing process is called as a lionization. This is absolutely normal, physiological. Okay, there is no doubt it is physiological. Now what if during this lionization, for example there is this one female, okay, there is this one female, now she is like this, capital X, small x. Usually she is a carrier, normally she is a carrier, okay, one capital X is there, one small x is there. But there is no problem, this is X-linked recessive, right, no problem. But what if in majority of her cells, if this chromosome is silenced, then who is expressed? Only this is expressed. So due to lionization process, if the normal healthy X chromosome, if it is getting lionized or silenced, then this abnormal chromosome is going to be expressed. So that can lead to X-linked recessive disorders in a female child, possible. Okay. So the third condition is something like this. For example, it's a deceased male. Okay, deceased male. You know it, males are going to be usually deceased. Okay, deceased male crosses with carrier female. This is extremely rare. Deceased male is going to cross with carrier female. Now male is having a disease, for example capital X, sorry not capital X, it's deceased male, right? So small x and y. Okay, small x and y. This is a deceased male, no doubt. He is crossing with carrier female. What is carrier female? Small x and normal x. Small x means there is, yeah, defect, there is defect, okay, there is mutation. Now see, this couple when they mate, it's going to be small x, it's going to be small x, sorry, it's going to be small x, capital X, okay, small x and capital X, small x and y, capital X and y, okay, capital X and y. So now let's see, first of all this is a female, this is also a female, male, male. Now see, this is definitely autosomal, sorry, X-linked recessive disorder, right? X-linked recessive disorder. That's why I am showing here small x, okay, small x and capital X. So this is a carrier female, okay, this is a carrier female. But look, who is affected in the offspring? See, females are getting affected. So when a deceased male going to mate with, when a deceased male is going to mate with a carrier female, there is a probability that they can have a female daughter, the daughter with disease. So it's a daughter, that's a female with disease. Okay, females can manifest the disease. So what is this? This is carrier female, this is affected male, this is normal male. Okay, so 25% of the offsprings are going to be carrier, 25% are going to be, sorry, 50% are going to be affected. So this 25 plus this 25, they are affected, one female and one male, they are affected, 50%. Like offsprings are going to be affected, 25% chance of having a normal child, 20% are having a chance of carrier. So female will be carrier. There is a 25% chance that they can have a normal male child, Okay, so I have explained you clear that X-linked recessive disorders are going to mainly affect the males, but there are 3 conditions in which a female can be affected. The first condition is the Turner female, second condition is due to the process of lionization, and the third condition is because of a defective male or a deceased male is going to have a child with carrier female. Then female child can be affected, no doubt. So after this, let's discuss about the diseases. Now, diseases which follow X-linked recessive inheritance pattern, XLR diseases. Now the mnemonic I used to follow is ABCDF. Okay, ABCD something like that. Okay, A stands for hemophilia A and B. Hemophilia A and B. Hemophilia A and B. See, hemophilias. Now the blood related disorders which I have discussed in autosomal dominant hereditary spherocytosis. The blood related disorder which I have discussed, the anemia which I have discussed in the autosomal recessive disorder, sickle cell anemia, as well as one thing called as a Fanconi's anemia. Now, hemophilia, Okay, hemophilia, bleeding disorder. Okay, bleeding disorder, it is X-linked recessive, like hemophilia A as well as hemophilia B. But remember, hemophilia C is autosomal recessive. Okay, just remember this, not that much hiding, but hemophilia C is autosomal recessive. Okay, now B stands for Burton's A gamma globinemia. A gamma globinemia. Okay, Burton's A gamma globinemia. So in this condition called as A gamma globinemia, there is no antibodies. Okay, antibodies are not getting produced. Without antibodies, there is no opsonization. Okay, see, for opsonization process, you require IgG antibodies, IgM antibodies. They act like opsonin so that better phagocytosis can occur. But in this condition, Burton's A gamma globinemia, A gamma, in the name itself it's there, A stands for no gamma globins, no antibodies. As there is no antibodies, no opsonization, so no phagocytosis, recurrent infections can occur. Okay, that's the point. So it's a defect in opsonization. In Burton's A gamma globinemia, what's the problem? Defect in opsonization. Okay, defect in opsonization. Next, C stands for color blindness. Which color blindness is more common? Red-green. So red-green color blindness. Okay, red-green color blindness is not the red. Tritanopia, deuteranopia, okay, protanopia is there, right? So red-green color blindness, a combo of red-green. So that's why in many exams they have asked you, the red-green color blindness or simply color blindness is going to affect which sex? It's X-linked recessive disorders. Male sex is going to be most commonly affected. Okay, so ABC completed. Next, one more C is there, that is chronic granulomatous disease. Okay, chronic granulomatous disease. In this condition called as a chronic granulomatous disease, there is a deficiency of NADPH oxidase. Okay, NADPH oxidase is deficient, so there is no oxidative burst. See, this oxidative burst is needed to kill the microorganisms. It's an oxygen dependent killing process. In the oxygen dependent killing process, oxygen is going to produce the free radicals, like this oxygen is going to produce superoxide, hydrogen peroxide. From there you will produce hypochlorite ions. See, actually in a simple way, oxygen is required for the production of free radicals like HOCl, hypochloric acid, which is used to kill the bacteria. For that process, what do you require? This enzyme is required. NADPH oxidase is required for the oxidative burst, for oxidative killing. Okay, so oxygen dependent killing of the microbes. But if you don't have this enzyme NADPH oxidase, so that will cause a disease called as chronic granulomatous disease, where the patient is going to have again recurrent infections because the body cannot kill the microorganisms properly. Okay, CGD. Next disease, D. D stands for ABC, D, right? D stands for Duchenne's muscular dystrophy. Okay, Duchenne's muscular dystrophy, you know it. Dystrophin. Okay, there is absence of dystrophin. So what exactly is dystrophin? Dystrophin, it is present in the skeletal muscles. It's present in skeletal muscles. It's in physiology I have explained to you, dystrophin is a peripheral protein. It's a peripheral protein. Where it is present? It is present in the skeletal muscle. It gives the muscles tensile strength. If this protein is absent, it's actually the dystrophin gene is the largest gene. The gene for dystrophin is the largest gene in the entire human genome. See, if this protein is absent, this peripheral protein is absent, dystrophin is absent, it's going to cause a disease called as a Duchenne's muscular dystrophy, where this child is going to have the weaker limbs, weaker muscles. He cannot stand properly. Okay, from squatting position, if you ask this person to squat, from squatting position he cannot raise properly. So he is going to use his upper extremities to lift his body. That sign is called as a Gower sign. So this is a question which was asked. Gower's sign. The patient is going to lift his body by using his upper extremities. Okay, the child is going to lift his body by using the upper extremities from squatting position. While he is standing, he will use his upper extremities. That is called as a Gower sign. And one more sign, if you look at his calves, the calf muscles are totally gone, totally damaged. They are dead. So in the place of calf muscles, lot of adipocytes will come and deposit in that area, and they settle in that area. So if you look at his calves are going to look bigger in size. They are going to look bigger in size. So that is called as a pseudo calf hypertrophy. Actually, they are not calf, it's nothing but a fat. Pseudo calf hypertrophy. Okay, pseudo-calf hypertrophy is going to be seen. So Duchenne's muscular dystrophy is complete absence of dystrophin. If there is deficiency or defect, okay, if there is deficiency, it's going to cause a disease called as Becker's muscular dystrophy. So complete absence is Duchenne's muscular dystrophy, deficiency is Becker's muscular dystrophy. Okay, it's done. So A, B, C, D completed. E stands for Lesch-Nyhan syndrome. So just this E. Okay, Lesch-Nyhan syndrome. So Lesch-Nyhan syndrome, you know it. So Lesch-Nyhan syndrome, the patient is going to have the gout. Because of what? Because of HGPRT deficiency. So HGPRT deficiency is going to cause Lesch-Nyhan syndrome. You know it, the Lesch-Nyhan syndrome fellows, they are going to do the self-mutilation. They are having something called as a self-mutilation, and their urine is also going to show the orange color crystals. So that Lesch-Nyhan syndrome, where the patient is going to have the gout, accumulation of the uric acid, this Lesch-Nyhan syndrome is going to follow X-linked recessive inheritance pattern. Next, I have already explained you in the previous video, all the lysosomal storage disorders and glycogen storage disorders follows the autosomal recessive inheritance pattern. But which lysosomal storage disorders follow X-linked recessive inheritance pattern? Two things, Fabry's disease, okay, and one more thing is Fabry's as well as Fabry's and Hunter's disease. See, these two are the lysosomal storage disorders. They will follow this. And one more F which I want you to know is Fragile X syndrome. So in this Fragile X syndrome also, Fragile X syndrome follows multiple inheritance pattern, but mainly X-linked recessive. Okay, X-linked recessive more than X-linked dominant, because both X-linked dominant as well as X-linked recessive, it follows both the inheritance pattern, but mainly it is X-linked recessive. A, B, C, D, E, F completed. Next G stands for G6PD deficiency anemia. Okay, G6PD deficiency anemia. So G6PD deficiency anemia, first thing, as well as one more anemia is there in the first starting I have discussed hemophilia. So blood related condition, two blood related conditions here I am discussing, hemophilia A and B, as well as next G6PD deficiency anemia, two blood related conditions A and G. A, hemophilia A and B, but hemophilia C is autosomal recessive. G6PD deficiency anemia is X-linked recessive condition. Okay, A, B, C, D, F, G, H. The last H here it's there, Hunter's disease. So these disorders are going to A, B, C, D, F, G, H. Okay, these disorders are going to follow the X-linked recessive inheritance pattern. Now let's continue with the X-linked dominant disorders. X-linked dominant disorders. So now in X-linked dominant disorders, for example, let's take male as well as female. Father is having a disease, X dash. Here I am representing wherever there is a dash, that's a mutated thing, that's a disease. Okay, X and Y. Now X dash means father is affected. This is a thing. Mother is normal, for example, XS. Now they are having a cross. Now let's cross. Now see, their offspring is going to be X dash and normal X. Next, one more X dash and normal X. Something like, let's put it here, X dash and normal X. Now see, normal X and Y. The point which I want you to know is in males, see, always X chromosome is coming from. See, in males, this is a male, right? See, in always the males are going to get the X chromosome only from the mother. Mother is giving the X chromosome. Okay? Males always receive the X chromosome from mother and Y chromosome from the father. Keep this point in mind. Males will have X and Y chromosomes, right? X is always coming from the mother. Y is always coming from the father. So now see, in this condition, if a father is having, now the father is affected father. Okay, now the father is affected father. So if the father is affected, who is getting affected? Look, who is getting affected? In X-linked dominant disorders, okay, all these X-linked dominant disorders, if a father is having the disease, father is going to spread the disease to the females. Father is going to always affect the females. Okay, so write, if father is affected, or you can simply say affected father spreads disease to females. Affected father spreads the disease to females. So that's why here affected, female affected, because this is X-linked dominant condition, X-linked dominant condition. So X dash disease, that's it. Okay. Now, for example, if mother is affected, for example, here in this condition mother is normal mother, right? Now, let's see one more pedigree where mother is affected. Okay, let's put it this way, affected mother. It's this side, this is mother, XX mother, right? So mother is affected, X dash, crosses with healthy father, X and Y. This is healthy father. Okay, healthy father. This is affected mother. Now what happens? See, X dash and X, X dash and normal X, X dash and Y, X and X, X and Y. So, who is affected? See, if mother is affected, mother does not have any partiality, sir. Remember that one thing. Mother does not have any partiality. Father always to the daughter. Father always to the daughter. But mother says 50-50. So, here female is affected, X dash, female is affected as well as male is affected. So, 50% of the offspring, 50% of the offspring is affected, 50% of the offspring is normal. Even in affected group, 50% female, 50% male. So, the point which I want you to know is always autosomal dominant conditions. Okay, autosomal dominant conditions. See, if father affected, female affected. If mother affected, both male and female are affected. 50-50%, 50-50%. Okay, so this is the point which I want you to know. So, let me write here, take a note. Affected mother, affected mothers are the mothers with the disease. Okay, affected mothers pass the disease to 50% of the offspring. Okay, 50% of the offspring. Okay, 50% males, 50% females. Okay, and done. Now, what are the examples of diseases which follow autosomal, X-linked dominant inheritance pattern? Which diseases? Alport syndrome, Alport syndrome, which is nephritic syndrome, right? It's a nephritic syndrome where the patient is going to have hematuria, recurrent hematuria can be seen. Alport syndrome, Rett syndrome, okay, Rett syndrome, vitamin D resistant rickets, okay, vitamin D resistant rickets, as well as last condition which is called as incontinentia pigmenti. Okay, incontinentia pigmenti. So, these conditions like Alport syndrome, Rett syndrome, vitamin D resistant rickets as well as incontinentia pigmenti, they follow X-linked dominant inheritance pattern. Again and again I am telling you. See, in X-linked recessive disorders, the first thing that I have discussed, in X-linked recessive disorders, always males are affected. Mainly males are affected. Okay, in all, it doesn't matter male or female, mainly in X-linked recessive disorders, males are affected. Only 3 conditions in which the females are affected are the Turner syndrome due to the process of lionization, or if an affected male is going to cross with a carrier female, then they can have a female who can manifest X-linked recessive disorder. And X-linked dominant conditions, in X-linked dominant conditions, affected males always spread the disease to the females. And if a mother is having an X-linked dominant condition, okay, she is going to spread the disease to 50%, means to the males and females equally. There is no such thing like only females or only males. She will spread the disease to males as well as females. So, 50% of the offspring will be affected, 50% of the offspring will be normal. Okay, examples of X-linked recessive disorders A, B, C, D, E, F, G, H, and examples of the disorders which follow X-linked dominant inheritance pattern is Rett syndrome, you know it. Okay, Rett syndrome, vitamin D resistant rickets, as well as incontinentia pigmenti and Alport syndrome. With this, we have completed the X-linked disorders also. Okay, in the next video, we'll discuss about chromosomal disorders. Also, we'll discuss about non-Mendelian inheritance patterns in the subsequent videos. Hope the video is helpful. Thank you.